My name is Sanjay Gupta. I'm a cardiologist in New York. Today's video is on the subject of stress and the heart. So imagine this. An earthquake hits, and within hours, hospital admissions for heart attacks spike. No change in diet, no change in exercise, just one common denominator: stress. So today, let's talk about the hidden yet profound impact of stress on the heart. So the first thing we need to talk about is the physiology of stress. Okay, when we are under stress, whether that is physical, emotional, or psychological, our body reacts as if it's under attack. This is the classic flight or fight response driven by a surge in hormones, stress hormones such as adrenaline and cortisol. These hormones will increase the heart rate, they will elevate the blood pressure, they will constrict the blood vessels and make our blood more prone to clotting. Short term, this helps us survive, but chronic or acute extreme stress, that can be deadly. Let me give you some real world examples. Let's take some. There was a study that was published in 2009 in the New England Journal of Medicine, and it showed a threefold increase in sudden cardiac death following the 1994 Northridge earthquake in California. Similarly, after the 2011 earthquake and tsunami in Japan, researchers noticed a rise in acute coronary syndromes in the days that followed. In both cases, the physical stress of the event was compounded by fear, grief, displacement, and anxiety, creating a perfect storm for the heart. There is a condition also known as stress-induced cardiomyopathy, or Takotsubo's cardiomyopathy. Sometimes it's also referred to as broken heart syndrome. It is a real diagnosable form of heart failure that occurs in response to sudden emotional or physical stress, like the death of a loved one or intense fear. The heart's left ventricle weakens and balloons out at the tip, taking on a shape reminiscent of a Japanese octopus pot or takotsubo. So it's narrow neck, and then the bit at the bottom, the apex of the heart, dilates. And so, the way the pot works is the octopus pot works is that the octopus goes into the pot and then can't get out because the base opens up. So in Takotsubo's, this is a very classic example, whereas instead of the heart pumping like this, you just see the heart pumping like this. And this bit here remains, doesn't constrict like it should, so it'll be just like that. And the presentation mimics a heart attack: chest pain, ECG changes, elevated cardiac enzymes like troponin. But when you go and do an angiogram to look at the blood vessels don't show any blockages. The heart is literally stunned by stress. So what exactly is going on here? Stress doesn't just make us feel tense, it triggers a cascade of physiological events. Vasoconstriction, narrowing of blood vessels, increases, and therefore afterload on the heart, what the heart has to pump against, increases. So the blood pressure goes up because all your peripheral blood vessels will squeeze and the heart has to pump against a higher resistance. There is an increased clotting tendency, so stress will increase fibrinogen and platelet activation, which raises the risk of thrombosis. And a lot of heart attacks, sudden events occur because of acute thrombosis. It can cause endothelial dysfunction, so stress can impair nitric oxide production, limiting the vessel's ability to dilate. And autonomic imbalance, persistent sympathetic activation with reduced parasympathetic tone, can promote inflammation and heart rhythm disturbances. Even in the absence of atherosclerosis, this perfect storm can lead to ischemia, arrhythmias, or pump failure. It's not just acute events. Chronic stress like caregiving strain, which I've talked about, financial hardship, or work-related burnout has been associated with a higher rate of hypertension, diabetes, obesity, and coronary artery disease. There was a study called the Whitehall study, which followed thousands of UK civil servants and found a strong association between work stress and cardiovascular risk. Stress also leads to unhealthy coping behaviors, poor sleep, increased use of cigarettes, alcohol use, lack of exercise, all of which will compound cardiac risk. What can we do? Well, the message is clear. Stress is not just in the mind, it lives in the heart. Managing stress is not a luxury, it is a necessity. Techniques like mindfulness, deep breathing, yoga, therapy, and meaningful social connection have real measurable benefits on heart health. So, the next time anyone says it's just stress, do remind them that for the heart, stress is anything but just. I'd love to hear your thoughts. All the best.